Hello, everybody, and welcome to today's Q&A on anxiety. I'm your host, Dr. Elise Snipes. Please feel free to start asking questions. I'm not sure I'm going to have a moderator today, so I may be doing double duty, but I will answer questions as they come in. The first question that is here is, can Reiki help ease anxiety? And the answer is yes and no. For some people, it is very effective at helping them reduce their anxiety and move their energies through their body. For other people, just like deep breathing can be very triggering for them, it can be triggering and actually increase anxiety. Or if they have ADHD, for example, and have difficulty clearing their mind or focusing on their breath, it can actually be frustrating to them. So ultimately, just like any tool, it's going to be important for people to explore it and figure out, does this work for me? Oh, hello, Adriana. I didn't expect you to be here today. It is very, very late where Adriana is, so I appreciate her being here. What other questions do you have about anxiety? I see there's 30 of you here, so I'm sure that you're here for a reason. Anxiety, if you will, is one of our fight or flight emotions. And yes, I know the stress response is fight, flight, freeze, fawn, or forget about it. But today we're just talking about flight. And flight can take a lot of different forms, whether it is running away, whether it's being anxious, or sometimes people will flee mentally by checking out, by dissociating, or by using substances. If focusing on your breathing causes you anxiety, you are not alone. Slowing your breathing ultimately is important, but you can do it indirectly. You can blow bubbles. If you have bubble gum, you can chew bubble gum and blow bubbles, and that slows your breathing. You can sing really loudly. That can help slow your breathing. Focusing on getting grounded can also be helpful, because when you are grounding yourself, what you're doing is turning your attention away from that anxiety-provoking stimulus and focusing on something that's neutral. The standard that we use is 5, 4, 3, 2, 1. When you start feeling anxious, identify 5 things that you see, 4 things that you hear, 3 things that you smell, 2 things you can feel, and 1 thing that you can taste. Now, feel and taste are a little bit ambiguous for some people. When we talk about feeling, right now, I feel my sweater on my arm, and it's one of my favorite soft, fuzzy sweaters. And I feel my bum on my chair, which it's kind of been there all day. But I am noticing what I am feeling right now. It doesn't mean it's, something I hadn't noticed before, but it turns my attention there. So my brain's not over here in anxiety land, if you will. And when I do that, when I start focusing on neutral stimuli, it helps my autonomic nervous system kick in. It helps my vagus nerve kick in and start down-regulating. Another thing that can help you down-regulate is just chewing in and of itself, chewing gum, even if you're not blowing bubbles. And then you can do vagus nerve massage, which you put your middle finger on your tragus, which is the little flap on your ear, and your index finger right behind your ear, and you massage it just hard enough to make the skin move. You don't want to be pressing that flap down. And that actually has been shown to stimulate the relaxation response. So all of those things can be used to help downregulate. Other things that can be helpful is using distress-tolerant thoughts. When you start feeling anxious, instead of going, uh-oh, here it comes again, I'm going to be overwhelmed by this tsunami. All right, here it comes again. And I've been able to tolerate it before. It'll come. It'll be unpleasant for a minute. It'll go. And I recently did a video on using cognitive behavioral therapy for a rich and meaningful life. And I talk a lot about acceptance and commitment therapy that can be very helpful with anxiety. Unhooking from that feeling. I'm feeling anxious. Does it mean there's something to be alarmed about? How do you overcome being nervous about getting into the world and becoming successful? One step at a time. And there's almost always a little bit of anxiety when you step outside your comfort zone. You've been doing what you've been doing and you're good at it. And you know how to do it. You know what to expect. So it doesn't make you anxious. When you start doing something new, that's a stressor. And it's going to make you anxious / excited. And that's okay. Embracing that and saying, okay, my body's given me energy to deal with this change that I am undertaking right now. Identifying and when I say identify, for me, I'm a list person. I would say make a list of the things that you are anxious about with getting out into the world and becoming successful. What exactly is triggering your anxiety? What are you worried about? And what are you telling yourself about those things? Once you've identified your self-talk, then you can go through and evaluate it for the facts in this context at this time. And if you remember back to that video that I did on contextual cognitive behavioral therapy, the mnemonic for that is FITCAT. Facts in this context at this time. And it really helps you logically, unemotionally evaluate what's going on right now. Once I have the facts, then I can decide what to do about it. It's also important to explore some of the things that are causing your anxiety and where you got those messages from. That, how do you define success? And when you start defining success, is that how you define success, or how your parents define success, or how your culture defines success? And what do you believe? A lot of people, bless Jay, you're not alone. When your hormones get altered, I won't say out of balance, but when they get altered during PMS, a lot of people experience bouts of anxiety and anger. Both of those are stress responses. That's perfectly normal. It sucks, but it's perfectly normal. And just like I was saying before, a lot of our anxiety is maintained, if not caused, but maintained by what we tell ourselves. When you start feeling anxious, writing down what you're anxious about and evaluating the accuracy of whatever that is. When you are PMSing, for lack of a better verb, it's also important to recognize you are physiologically different during that period than other times, which means you are going to probably respond differently. Your estrogen, progesterone, testosterone levels, all of those impact the availability of hormones and neurotransmitters. When estrogen goes up, people tend to have more anxiety. When progesterone goes down, same thing. So understanding and working with your body instead of against it. And I wish there was a magic formula I could tell you that all of a sudden this would make you feel, 100% better. I can't. Just like when you get, I hate to liken this to being ill, but just like when you get a cold or a flu, you know that you're not going to be 100%, or you're going to be a little slower doing stuff. The same thing is true when you are PMSing. The nice thing with PMS is you can kind of anticipate it, unlike the flu, which just kind of comes out of nowhere. I do have videos on the YouTube channel, by the way, on the impact of our hormones and estrogen on our moods, so you may want to check that out. Would having a pet help to ease anxiety? For a lot of people, it does. Now, if you can't afford a pet or you're not allowed to have a pet where you're at, then that may increase your anxiety. And I will tell you, I love my pets like part of the family. And when they get ill, it increases my anxiety. So it's not going to be a panacea, but for a lot of people, it does help ease anxiety. And even cats, which tend to be a little bit more independent than dogs, have been shown to lower people's blood pressure, their stress response, and their anxiety when their owners are able to hold and pet them. Let me just take a break here. Got some of his hair on my nose anyway. Come here, buddy. This is my Mojo. And I intentionally named him that because I used to tend to hold on to anxiety and negative emotions and nurture them. And now, whenever I start feeling stressed or irritable, I grab my Mojo and I nurture that. And I know it's semantic or silly or whatever, but it does remind me of the importance of using my energy to nurture good Mojo instead of nurturing stuff that's going to take me away from my rich and meaningful life. When will I be able to accept that my husband has passed away from being killed by a juvenile in a hit and run? I can't tell you that, and I'm sorry. Unfortunately, grief is unique for every individual, and the fact that this was a sudden death makes it even more traumatizing in a lot of ways. So dealing with the trauma of the loss is going to be one of the things that is important. Recognizing all the secondary losses you experienced as a result of losing your husband so suddenly, but losing your husband, period, it changed your life. It changed what you envisioned for the trajectory. So there's a lot of stuff that really needs to be adjusted for your, and I don't like the term, but for your new normal. And how long that takes is dependent on you. And it's not that you're not doing something. It's not that you're failing in grieving. What you're doing is taking the time that you need. My stepfather lost his first family in a fire. And when I met him, that had been 45 years ago. And there were still days, especially around the anniversary of their death, that was very hard for him. And being compassionate with yourself. There is something that they call prolonged grief disorder. It's a new disorder in the DSM-5 TR. I'm not sure how I feel about that. The one reason that I like it is that counselors can bill for it. So if you're feeling like you're not making progress working through your grief and you want to see a counselor, it's something that should be covered by insurance. But there is no set time that we can say you'll be over it. The old adage that you need a year to get past a loss, research has shown that that's not the case. Most people to integrate, let's say that, integrate the loss, because you never really get over it. You integrate it. It gets easier to live with. And that generally takes 2 to 3 years for significant losses. And for complicated grief, like you're going through, it can take even longer. I would encourage you to reach out to people who have had similar experiences of losing a spouse suddenly and see if there are any support groups. Reach out if you have a faith leader that you like, if you have a counselor that you like, to be able to bounce some ideas and get some support while you process this. You are in control. You are the one that says when you have integrated that grief. It's not for anybody. No counselor, nobody out there can take away your grief. And I wish we could sometimes, because I hate seeing people hurt. However, that is one of those things that will require some reintegration and rewriting of how you envisioned your future script to be. How can I be confident and focused on work? Identifying, and there's a lot of anxiety and fear of rejection and fear of failure that happens when we step outside of our comfort zone. And being confident means, in part, recognizing what your capabilities are. What are you able to do? What do you do well? And recognizing that nobody, and I'm comfortable saying that, nobody does everything well ever. I can't do everything. Naming off anybody you can think of, they can't do everything. Michael Jordan can't do everything. But there are some things that each person does really well, and there are some things that you do really well. Recognizing that, doing that to the best of your ability, recognizing where you have weaknesses, and weaknesses are okay. That just means you're not perfect at everything. Imagine that. And seeking support, seeking synergy, finding somebody who has those strengths can help you be more productive at your job. One of my favorite books is The 7 Habits of Highly Effective People, where Covey talks about begin with the end in mind, visualize where you're going, seek first to understand and then to be understood, synergize, create win-wins. There are a lot of things in there that help us in our business life, not just in our personal life. When I was working in community behavioral health, I loved writing grants, and I loved implementing grants when we got them. But after about 2 years, after we got the grant and I had it all up and running and had all the standard operating procedures written, I was ready to pass it on. My strength is in creating and, building up things and then turning it over to somebody else to run it after that. And that's okay. I get bored. I'll be honest. I get bored if I keep doing the same thing year after year after year, and there's no challenges. So that's one of my weaknesses. But there are people who love just maintaining what's going well and keeping it working. Great. So we all balance each other out. Are there other, if you want to ask me follow-up questions on that, I am definitely happy to answer. If I don't hit your question correctly or if I don't fully answer it, please feel free to follow with a follow-up. How do I deal with anxiety during perimenopause? I used to have anxiety 2 weeks before my period. Now I have anxiety every single day. Unfortunately, there's 2 potential main causes of that. One of them is biochemical, and I would encourage you to consult with your doctor about the feelings you're experiencing, whether you choose psychopharmacology or hormone replacement therapy or herbs or something else to help you temper that anxiety. What's important is your quality of life, and having anxiety every single day is awful. It's rough, and not to mention hot flashes and everything else. So that's one thing. Part of it is just plain physiological. Your body is having some little spurts of estrogen here and there that can cause hot flashes or contribute to hot flashes and anxiety. It's possible too that there may be anxiety about the change, if you will. That's what my grandmother always used to call it. What that means for you and what it's going to look like and how long will it last. Again, your doctor can help you with that. But as far as the larger concept of how you feel about yourself and your self-esteem and fear of rejection as you get older, that may be something else that is contributing to your anxiety. My guess would be that 80% of it is biological and neurochemical, where you tended to already have some anxiety sometimes. And when your hormones switched, and now that your hormones are all over the place, the anxiety is a lot worse. There are remarkable treatments out there that can help you manage your mood and your anxiety levels. You are quite welcome, Blessed Jay. Thank you, Robert. He's one of my little prides and joys. Thank you for sharing, Robert. Question. I have anxiety. It gets worse when I'm around my oldest. He's more so controlling and narcissistic and mentally, emotionally abusive. When you're around somebody who's unsafe, your anxiety is going to go up. Anxiety is your brain's way of saying, hey, this might not be a safe situation. There might be a threat to me. And determining how to set boundaries and get safe in his presence is going to be essential for you not to feel anxious when you are around him. Stress can be really high. And in some of my older videos, I talked about Lenny. Lenny is the elephant that sits on my chest when I get stressed out. And it feels just like that, like I've got an elephant sitting right there. And when my anxiety starts to subside, Lenny goes away. And I really love it when Lenny goes away. Recognizing how your stress level is impacting you in all pieces of your life. How's it impacting your gut? We know that it's going to change your gut microbiome. How's it impacting your desire to eat, your nutrition, your ability to get good sleep, your energy levels? How does it impact your relationships with others as well as yourself? How does it impact your other feelings and how clearly you can think? So anxiety, this little word, really has big tentacles that can affect all pieces of our life. And recognizing that and being authentic about it is so important. If you're having an anxious day, acknowledge it. Let the people that are appropriate, you're not going to go around and tell the cashier at the grocery store, hey, my anxiety is high today. But your significant others, the people that you live with, your office mate at work, maybe it's appropriate to tell them, hey, I'm feeling really stressed out today, so, just please give me a wide berth. A lot of people are so appreciative if you just give them a heads up. And we've been taught in many cases that we should suck it up, buttercup. That's not healthy. That's not healthy because we can't just automatically turn off anxiety. We need to understand where it's coming from, and we need to feel safe. You may not be able to address all of the underlying issues, but the question is, what do I need to do to feel safe in this situation at this time? How can I overcome seeking validation? I constantly do this. Seeking validation often comes from fear of abandonment, anxiety of being rejected and abandoned. And I would encourage you to watch some of the videos on strategies to deal with fear of abandonment, but also to recognize to a certain extent, part of it may be your love language. Some people need those words of affirmation. That's how they feel loved. That's how they feel connected. So they need their significant other to say, you're really awesome. And that just makes their day. If words of affirmation are not your love language, somebody can say that to you and you're like, hey, thanks, no big deal. But for people for whom that's their love language, it really is spot on. Looking at your history, where did this fear of abandonment or need for approval and validation come from? Working on your self-esteem. Why is it that it is difficult for you to feel comfortable in your own skin? And when I do our video on relationships, I talk about relationships like chocolate chip cookies. Chocolate chips by themselves, you can eat them straight out of the bag. They are good just by themselves. Thank you very much. Sugar cookies by themselves, really good by themselves. Thank you very much. The two of those things, just like two independent people, are able to stand on their own, and they're wonderful as they are. They don't need anybody to complete them. They're complete. When they get together, they bring out the best in each other. And the same thing is true in cookies and people. That's what we strive for in our relationships. And if you don't feel like you are good enough on your own, thank you very much. I would encourage you to explore where you got the message that you weren't good enough, or if you didn't get constant validation, that it was a sign you were going to be abandoned. For a lot of people, that dates way back to childhood. Not for everybody, but for a lot of people. Becoming aware of your need for validation, and when you're asking for it, what are you seeking? Are you seeking reassurance that he's not going to leave? Are you seeking reassurance that you're okay and you can do this? Somebody that's encouraging you. What is it that you are needing? What void is it that you're needing to fill at that point? LaPortia asks, is social anxiety different from inner self-given anxiety? I'm not familiar with the last term. If you could clarify, that would be great. Social anxiety is the fear of being in an environment, being in a public place or in a social situation, and being greatly embarrassed or humiliated or judged. Some people have a significant fear of that, especially if you've grown up in dysfunctional households where you had to become hypervigilant to those around you in order to stay safe. You may still be hypervigilant now, and you may interpret and misinterpret people's nonverbals as rejection or disrespect or something else. And it may make you feel unsafe in social situations. So a lot of social anxiety is really learned from prior social interactions that were unfortunately unsafe. Is the fear of change and holding on to the past the opposite of resiliency? I don't know if they're the opposite. Everybody fears change. Change causes crisis, and crisis causes change. We can look forward to some changes, but it's still a little anxiety provoking, and that's okay. Recognizing that change is hard, and our desire to hold on to the good things of the past, well, that makes sense. You don't want to get rid of something that's good. Resiliency is being able to bounce back when bad things happen. Think about taking a ball and pushing it down in the pool under the water. And then when you let it go, it bounces back up. That's resiliency. And when you go through something and it knocks you down, you get back up. Another example I used to use, I actually was looking for some of these the other day for my cats, Weeble Wobbles. There were these little tiny toys that you could push down and they would pop right back up. And that is the definition of resiliency. Being able to get yourself back up and keep moving forward despite setbacks. My daughter struggles with severe anxiety attacks triggered by certain foods like chicken. She's connected these foods with previous health problems. How to prevent anxiety triggers? Well, the first thing would be to look and see if there is a physiological basis to her anxiety triggers. And if not, then something like systematic desensitization would be an approach that I would take if she were my patient. Also recognizing if there are certain foods that trigger her anxiety, are these foods she needs to eat? Not all of us like to eat everything. When I was pregnant with my daughter, anything sweet would make me violently ill, whether it was soda or sugar or chocolate, and I love all those things. And after I had her, it was such an aversive experience that I avoided them for the longest time. And then I finally gave in. But the other thing that we might consider from a behavioral perspective is what we call superstitious reinforcement. When I ate chicken, this bad thing happened. Therefore, it must be the chicken that caused it. Is it the chicken, though? Or did something else happen that caused that bad thing? I ate this chicken and I got violently ill. So, was it the chicken that made me violently ill? Maybe. Or maybe you had a virus that just happened to kick in an hour after you ate dinner. I don't know. But always looking for that confounding variable. What else might have caused this can be helpful. Now, I don't know how old your daughter is, but those are some strategies that I would use with an older child. I'm thinking 16 and above. I have anxiety over future health issues. I'm not afraid of dying, but I think the anxiety is more about which illness I get, how severe it is, and coping, etc. I hear you. Most of my family has passed away from cancer, and that's terrifying for me. So I regularly kind of have a mental check-in with myself about health anxiety related to cancer. The first thing, recognize that getting stressed out about all this and staying stressed out is reducing your immune system. So if you don't want to get sick, one of the most prudent things to help you move toward that rich and meaningful life is to figure out ways to deal with this anxiety. Number 2, facts in this context at this time. What are you doing to keep yourself healthy so you don't get ill? And what risk factors do you have and how can you address them? Take steps to do those. And then there's going to be this unknown out there that you have no control over. All right, it's out there. You've done your best to, eat well, exercise, don't smoke, don't drink, do all those things that the doctors tell you to do. But there's still confounding variables. We realize this. All right, which moves on to coping. When or if you get sick, what strategies are you going to use to cope? What do you need to help you manage those particular illnesses? And your doctor, for whatever illness it is going to be one of the point people in helping you get access to the resources that you need. Now, I don't know how old you are. If you are older, well, I guess that's not true. You can get life care insurance or long-term care insurance at any point in your life. And that helps pay for example, in-home nursing. If you are incapacitated and from whatever illness it is and you need somebody to come in, it's an insurance that helps cover the cost so you don't have hundreds of thousands of dollars of bills every year. I would make a list of, like I said, what are you doing to prevent getting sick and to give yourself the best shot to fight off anything that you get? That's the first thing. Another list of what are your vulnerabilities and is there anything you can do to address them? And then a third list of what fears do you have about coping with it and what issues are you concerned about regarding coping with it, whether it's emotional, physical, or financial, and making a plan for yourself so you know, hey, if the bottom drops out, if the worst case scenario happens, I have a plan. And then look at probabilities. What is the probability based on what you're doing at this time that the worst case scenario is going to happen? And as my daughter said one time when I was perseverating over something that made me angry, she asked me, Mommy, is dwelling on this anger using your energy to help you move toward your rich and meaningful life or away from it? And she was like 11 at the time. So, out of the mouths of the babes. But at a certain point, it's going to be a choice to not feed those anxieties and feed those thoughts and really nurture them. It's going to be important to say, okay, I've done what I need to do. Now I'm going to focus my attention on living the richest, most meaningful life I can in the moment. How do you overcome constant fear? I can't get out of fight or flight. I'm stuck. I'm scared, but I don't know what about. That's exasperating. And sometimes, and I'm able to get out of it, which you are not right now. And I can't imagine how exhausting that must be. But sometimes you'll get this feeling of anxiety, this feeling of dread, and you don't know where it's coming from. There's no easy answer to that. For people who are in a constant state of fight or flight, one thing I would look at is their history of trauma and whether their stress response is dysregulated. And I have videos on releasing trauma from your nervous system that can help walk you through addressing that issue. I would make a list when I'm feeling anxious. I would encourage you to start, journaling, and free-form journaling, not correcting spelling, not doing anything, just writing or saying whatever comes to your mind if you're doing dictation. And sometimes, it's a very Freudian approach, but sometimes you will start hitting on things that are causing you distress. The third thing I would do is look at the things that you're doing in daily life that may be adding to your anxiety, like doom scrolling, or even if you're not doom scrolling, how do you feel if you get in social media and you stay in there for a minute? How do you feel when you get out of it? Do you feel overwhelmed or exhausted, or do you feel recharged and supported? There are oftentimes a lot of things that we do that we don't really realize contribute to our anxiety, but then when we look back later, we're like, yeah, that really drained me and fired me up. Those are some tips that I would start with and then proceed from there. When you have this feeling and you can't quite pinpoint where it's coming from, it's hard to know exactly where to start. The reason I suggested the free form writing, just journaling for 30 minutes, is because once you start journaling and quit thinking about what you're doing, sometimes your subconscious will spill the beans. I feel you on those heart palpitation, Babs. People can have panic attacks. I have something called supraventricular tachycardia. And when I get really worn down and stressed out, I'll have those, and they are just wicked. So I know how terrifying it can be when your heart just starts going flippity floop. All right, let's see. PTSD does cause anxiety because the core feature of trauma is leaving people feeling whatever it was that was traumatic, caused the person to feel unsafe and powerless. And what does anxiety tell us? It tells us there might be a threat. We might be unsafe and powerless. So yes, very true. And you're right. A lot of people are very traumatized. A lot of people are very hypervigilant. I know even when I go to the gym now, if I sneeze or I cough or something, I'm not sick. I wouldn't be at the gym if I was sick, but I'm like, oh my gosh, I hope people don't think that I'm here and I'm sick and I'm getting them all icky. Or if I come home and I get a stuffy nose, and I just had a sinus infection. The first thought was, okay, what is this? And then the reality hit in. It's probably a sinus infection like I used to get 20 years ago, and it's no big deal. But the doom anxiety jumped in and said, are you sure? Are you sure it's not something worse? Yeah, I'm sure. I don't have a fever. I'm kind of snotty right now. So it was important for me to acknowledge that. And it's important for people to start getting back to looking at the facts in this context at this time and evaluating the probability that the worst case thing is going to happen. Oh my gosh. Okay, I'm going to go off on a rant for a minute. There was this article that came out yesterday or something, and they were talking about it on the news today, that there was a case of bubonic plague discovered in Oregon. And they say this lady's cat gave her bubonic plague. No, it didn't. Fleas transmit bubonic plague. The cat had fleas, which may have transmitted bubonic plague. Now, that may sound terrifying to you, but when you start looking at the research, getting the facts in this context at this time, bubonic plague and human plagues are actually not uncommon, especially in the western part of the United States and in many other countries. Additionally, we have drugs now, medicines now, that treat it. It's 100% treatable. So yeah, thinking bubonic plague sounds really scary and it can trigger anxiety, but when you get the facts in context, you realize, hey, it's no big deal. And it wasn't my cat. It was the fleas on my cat. So I need to make sure that cats don't get fleas. Okay, rant over with. Oh, sorry, buddy. I just scared Mojo to death. Resiliency is the ability to bounce back. And I'm not sure what you mean, beautiful, by adjustment issues. That's a really, in terms of the DSM-5 TR, that's a really vague term that we use for people having difficulty adjusting to something that's happened in their life. And yes, you need resiliency to adjust. So if you're not resilient, you may develop an adjustment issue. You may have difficulty coping with change. So I guess if you wanted to say it's opposite, then you could. When you're thinking about resiliency, think about all of the resiliency tools you already have, all the strengths you have that have helped you get through the trials and challenges and traumas you have already gotten through. We call it traumatic growth. Most of us don't push ourselves to grow a whole lot if we don't have to. But when we go through a challenge or a trauma, we have to. And when we get through that, when we successfully get to the other side, we've developed new skills and more confidence in our ability to handle trauma. And that's what we call traumatic growth. We're actually getting stronger. It's kind of like when you go to the gym and you start out lifting 10 pounds or whatever, and then you decide, hey, I'm going to try to lift 15. And it's really hard. But over time, it gets easier because you develop the strength. Your muscles grow and you develop the strength to deal with the stress. I am afraid of being judged. I just want to break this, but when I do, he puts me down and I'm being judged. Okay. Well, that's a whole horse of a different color, as my grandmother would say. If you're in an environment in which somebody is overtly judging you, then that can make you feel unsafe and fearful of rejection and fearful that you're not good enough. So yeah, feeling judged is going to lead you to seek validation. One of the questions I would have is he actually judging you, or are you perceiving? Does it feel like he's judging you? And sometimes if you grew up in a very harsh household that was critical and judgmental, then we may project those assumptions onto other people when they make certain facial expressions or something. We attribute to them what our parents meant or what our significant others meant back in that judgy, unhealthy relationship. Communicate with him if you're feeling judged, and to see whether you are being judged. And if he is being judgmental, then talking about what a better response would be. Being judgmental is an aggressive behavior. It's a boundary violation. When somebody says what you're doing is wrong, well, you may not like what I'm doing. You may disagree with it, but what I'm doing is right for me, and I have the right to it. Remember, boundaries keep you safe. Cognitive boundaries, I have the right to my thoughts. You may not agree with them, but I have the right to them. Emotional boundaries, I have the right to my feelings. Again, you may not agree, but I have the right to them. So it sounds like there's room to have a discussion with him about what you need and his reactions and how that affects you. If it's safe, of course. How do I deal with anxiety from pause? I was a drug user for 30 years, was on methadone for 5, got off it cold turkey 2 months ago. Oh my gosh, wow. Yeah, I'm not surprised your pause is just in full swing. Your hormones, your neurotransmitters, your body factory is completely miscalibrated right now. Acknowledging that your body needs time to heal is going to be one of the first things. Talk with your provider. I'm assuming you're still seeing a provider of some sort about your anxiety and strategies they may have to help you cope while your body heals, while your nervous system heals from what's going on. 2 months off of methadone is, it feels like forever. And wow, going cold turkey was probably excruciating. However, in terms of rebuilding your nervous system, it takes time. Identifying what triggers your anxiety and being as compassionate with yourself as possible during this time is going to be really important. Putting triggers in your environment for being calm and feeling safe is also going to be important. Little notes to yourself, you've got this, whatever you need to do. Having a plan to deal with your anxiety when you start feeling anxious, whether it's calling your sponsor or your coach or a support person, or going to the gym or doing something else, that can be helpful. Down-regulating, and I would really encourage you to practice and work on developing your vagus nerve, because right now your vagus nerve is not in control. Your stress hormones, your stress response system's in control, and the vagus nerve is just kind of kicking back going, whatever. It's going to be important, what they call it vagal tone. It's going to be important to start strengthening that vagal tone, your body's ability to turn off that stress response when it happens. Let's see, other things that might be helpful. Keep track of things that you do that make it worse, like drinking too much coffee, smoking if you're still smoking. I don't know if you ever smoked, but that can be helpful. Ultimately, also looking back at, for the 30 years that you were using, there was a reason, and it probably wasn't just physiological addiction. So there's probably a lot of trauma and a lot of grief and a lot of stuff that is coming to the surface now that it's not being numbed or hidden away by methadone and drugs. Again, being compassionate with yourself and working with a therapist or somebody to develop a plan to begin addressing some of those underlying issues and potentially inner child issues that are keeping you feeling unsafe and powerless. I agree, Babs. Long-term insurance is extremely expensive. And paying somebody to be a full-time in-house nurse is even more expensive. So some people have to take that gamble. There is some insurance, I think Aflac, I'm not for sure. They have long-term disability insurance, and they do offer some things that will help defray the cost of having in-home help. Once you get to be on Medicare, there are options available for a certain amount of in-home care for people. But, you know, you've got to be 65 to get on Medicare. And I don't think the people that I was talking to earlier were probably quite there yet. How do you deal with toxic shame? Because of that, I don't go outside, and it's very difficult. Toxic shame or toxic guilt is feeling angry at yourself for not being enough or for being what you perceive as broken. And it's important to evaluate for yourself, you know, what makes you a good person? What qualities do you have that are awesome? Work on your self-esteem and develop a sense of safety in your own skin. The people who are putting that toxic shame on you, who are telling you that you're not good enough, they are being very aggressive. They're violating your boundaries. It will be helpful to find people who are accepting and compassionate towards you instead of being judgmental. Sometimes toxic shame and toxic guilt are things we put on ourselves because we assume people are judging us. I don't know in your situation exactly what's going on. When you feel toxic shame, when you feel toxic guilt, it can be really hard to just turn it off. I do have videos on that. I would encourage you to go to docsnipes.com/docsnipes-AI, and you can ask my AI to help you find the video that I talk about toxic guilt and toxic shame, so you can evaluate some of the strategies that I offer in there. Can you use the same modalities and or practices? I'm assuming you mean to treat ADA, ADHD, and anxiety, or maybe you mean differentiate. If you're diagnosing, I would throw in there complex post-traumatic stress because ADHD can mask trauma. Trauma can produce ADHD-like symptoms. Cognitive behavioral therapy and executive functioning coaching can be very helpful for both ADHD and anxiety in different ways. But like any other approach, it depends on the individual. And not everybody will respond as well to it as others. With teens, cognitive behavioral therapy tends to be more helpful in older teens. Remember, tweens and younger teens are, well, even up until 24, people tend to be more impulsive. Their prefrontal cortex is not fully developed yet. But during the early teens and the tweens, a lot of people are going through puberty, and those hormone shifts and everything can contribute to all kinds of anxiety and brain fog and mood swings and other stuff that is developmentally normal, but it is horrible for the child when they're going through it. When people are in that stress mode, especially young teens and tweens, it's hard for them to switch it off. Thank you, CA, for your support. I am a Capricorn. That really stinks, Solid Snake, that somebody weaponized your own guilt against you. And unfortunately, people do that. It's one of the things that I see in some of the most nefarious pastors. They weaponize that. People have grown up or been around the church and they feel toxic guilt. They feel like they're not good enough. So they go to church to try to feel better. And the pastors tell them, hey, guess what? You're never going to measure up. And because of that, you need to come back here every single week. And I really hate that approach to teaching scripture. But people who are in positions of power often recognize other people's weaknesses and use them to their advantage, unfortunately. How do I set a boundary with my mother when she rages? She did this when I grew up, and it sets off and triggers my anxiety. The first thing is, I would wonder if you've told her, Mom, when you do that, it really freaks me out. She may not realize her impact on you. And you may be thinking, well, it's so obvious. Not to her. If she's raging, she is in fight or flight. She's not in observe and think and process. It can be helpful to have that conversation with her. It can be helpful to identify specific things that she does, not just when you rage. She may not know what that means. When you start screaming at me, when you start calling names, whatever it is that she does when she rages, express to her that those behaviors trigger your anxiety and what would be helpful for her to do instead. Or let her know that when she starts doing that, what you're going to do in order for you to feel safe. You may have to excuse yourself from the situation because it feels unsafe to you. I love you. I want to talk to you. I want to spend time with you. However, until you're able to get grounded again, until you're able to de-escalate, when this happens, I'm going to have to excuse myself. Letting her know that you're not rejecting her is another thing that can be really important. Is it possible to go through life without too much anxiety and stress? I've seen cheerful people who just seem to never get stressed. I can't tell you how other people feel. I can tell you that there is a good percentage of people who fake it because they've been told that nobody cares and you just need to have that smile on your face and be cheerful. There are also people who've developed the skills and tools to find serenity, to accept the things they cannot change, have the courage to change the things they can, and the wisdom to know the difference. And they choose to use their energy to move toward their rich and meaningful life. So do I believe people can be truly happy? Yes, I do. Do I believe that people are anybody is cheerful all the time? No. But the way we approach challenges has a big impact on our mood. If I see a challenge as a challenge, then I'm going to get excited about it. And I'm going to go, okay, now you don't tell me I can't do this. I'm going to figure out how to do it. Because I'm stubborn that way. But people who see challenges as obstacles, it's like this big lead wall right in front of them that keeps them from moving forward. And it feels disempowering and overwhelming. So part of it is how we deal with it, how we deal with stress when it happens. Do we embrace it? Do we look at it and go, okay, guess I'm going to get to work out my mental muscles today? Or do we fight against it and get angry with it? Thank you for your support, Robert Redmond. It is very helpful. Bless Jay, it is 7 habits of highly effective people. And I know, y'all are going to be surprised. I have a video on how to use the 7 habits for mental health. So if you search for 7 habits, it should come up for you. Overcoming resentment means letting go of anger. Resentment is anger at somebody for something they did. And that means, here's the F word, forgiveness. And forgiveness does not mean it's okay. Forgiveness means it's done. It is what it is. And I am choosing not to continue to invest my energy in that. I'm going to learn from it and I'm going to protect myself from it happening again. But I am not going to stay yoked to that, whatever it was that happened. I'm not going to carry it around with me on my back. One of the activities I have people do for resentments is to get a backpack, and we'll get backpacks for everybody in group, and we have rocks of different sizes. Those rocks they use for landscaping. There are some that are, good sized, and then there are some that are smaller. And they write their resentments on each one, and each resentment they have, they put in the backpack. And then I have them go on a walk for 20 minutes. And that backpack starts feeling pretty heavy. The same is true with how it's using your mental energy. Even if you're not literally carrying it, it's weighing you down. It's using your energy because there's a part of you that's constantly going, that made me feel unsafe. I've got to protect myself. Don't know how, got to protect myself. Alrighty, everybody. My hour has come to a close. I really appreciate you all for being so supportive. Very much appreciate the super chats or whatever they call them here. Very helpful for me to keep doing these things. And I will see you next Monday, same time, same station.